80 to 90% of people in the United States will suffer from back pain at some time during their lives. Most back pain is temporary, but many people suffer from persistent or chronic back pain. In those cases, surgery may be necessary for some, especially when bed rest, medication, and other conservative therapies aren't effective.
There are a lot of causes for chronic back pain. We tend to think of degenerative disc disease as probably one of the most common reasons, although arthritis in the facet joints can cause pain. You could have instability and fractures also causing pain. Disc herniations can cause pinched nerves in the cervical spine as well as in the low back, can cause arm pain and neck pain and low back pain as well.
For a wide range of debilitating back problems, treatment focuses on relieving pain and preserving range of motion while minimizing surgical trauma and promoting a fast recovery.
When we evaluate patients with chronic back pain, probably one of the most important things is evaluating how much pain they're having. Based on the level of symptomatology and the type of pain they're having, we decide if they need MRI, CT scans, or further diagnostic workups. Based on the symptomatology and the objective findings that we find, we then decide to come up with a treatment plan.
The elderly are not the only ones who suffer from back pain. Young people, especially those who are very athletic, often have pinched nerves, herniated discs, and stress fractures from repetitive activities that put stress on the back. It's important for young people with any orthopedic problem to consult an expert, because some untreated conditions can cause permanent damage and interfere with normal development.
Untreated spine conditions can potentially result in long-term problems. Disc herniations resulting in pinched nerves can potentially result in permanent nerve injury with weakness and disability. Untreated fractures in teenagers can potentially, in the long term, cause problems in adulthood. Untreated scoliosis can also potentially get worsened with time and the treatment be much more difficult.
Dr. Mohammed Etmanin, a fellowship-trained spine surgeon in suburban Houston, says new treatments and technologies are being developed all the time for patients who need spine surgery.
In the past 5 to 10 years, we have many new treatment options that allow us to treat chronic back pain quite effectively, to allow the patient to get back on the road to recovery without a long recovery time. Procedures like XLIF, cervical disc replacement, minimally invasive fusions, minimally invasive decompressions allow us to accomplish quite a bit of surgery with minimal tissue disruptions and allow the patient to recover very well.
Spinal fusion is a surgical procedure in which two or more vertebrae are joined or fused together. Fusion surgeries typically require the use of bone graft to facilitate fusion. A relatively new minimally invasive approach to the anterior spine, called the XLIF, which stands for Extreme Lateral Interbody Fusion, is a technique where the disc space is accessed from a very small incision on the patient's side. Once the damaged disc is removed, a synthetic implant filled with bone graft is placed into the empty disc space.
The XLIF procedure is a relatively new technique that we've been performing in the past few years. It's a very powerful technique that allows us to address degenerative disc disease, disc herniations, scoliosis. It allows us to perform quite a bit of surgery through a very minimally invasive incision with quick recovery times. The patients have been very happy with it and the results have been outstanding.
Dr. Etmanin is a leading spine surgeon and part of the group of orthopedic specialists at the Richmond Bone and Joint Clinic, treating such disorders as cervical and lumbar radiculopathy, scoliosis, spinal stenosis, degenerative disc disease, and other common back conditions.
We perform a variety of spine operations at Richmond Bone and Joint Clinic. We address cervical spine disease and problems with the neck, lumbar spine disease and the problems with low back. If you have a pinched nerve in your neck and neck pain, we do cervical disc replacements potentially. If you have back pain with pinched nerves in your back, we can perform a fusion in your back. We've done a variety of techniques. We can also do minimally invasive decompressions. We essentially have the whole array of treatment plans available at our disposal so we can treat the right person the right way.
The most common conditions that I refer to Dr. Etmanin on center around the cervical spine or the neck and the low back. Those patients that haven't responded to physical therapy and or oral medications are the ones that I send his direction. Especially those patients that have pain that radiates into their legs or into their arms.
I had severe pain in my left thigh prior to the surgery that prevented me from standing or walking for over a minute before the pain got so severe that I either had to sit down or stand up leaning on people or bending over in a weird posture. Subsequent to the surgery, since the surgery, I have been virtually pain-free. I can walk, I can bicycle, I've been able to sleep without pain, and it's changed my mood from one of depression to one of joy.
Prior to the surgery, I was in quite a bit of pain. I thought I was going to die, or I thought I was going to be paralyzed. I could not move, I could not walk, I could not do anything. Emotionally, I was drained. After the surgery, I became a new man, felt like I was reborn. I was able to carry on everyday activities again with no pain whatsoever, and been loving it ever since.
Before I had the surgery, the pain was excruciating. I couldn't stand or walk for more than 5 to 10 minutes without having shooting pains down my legs and numbness. I couldn't stand up straight. And since the surgery, I can walk all the way around the block twice, 2 to 3 times, and no pain at all, no numbness. It's perfect.
Before the surgery, the pain that I had before the surgery was very excruciating. I had pain in my legs with just with the numbness in the tops of my feet and on my down through my legs. And then after the surgery, it has become more, I have no pain whatsoever. I mean, it's almost like I had never even had to have a surgery. This is like normal again.
The conditions that most commonly have a successful outcome are those patients that have a very well-defined set of symptoms that have been through a very well-defined course of treatment prior to surgery. Those patients that do have to go through surgery with Dr. Edmond on have come back and talked to me and let me know that their pain has gotten better, the function has gotten better.
Treating a variety of spinal disorders and other common back conditions, Dr. Etmanen and the experts at Richmond Bone and Joint Clinic offer patients the latest treatment for spinal injuries and disorders.
Spinal disorders tend to be quite challenging to treat. I think treating spine is more of an art than a science. Different patients have different set of symptomatologies with different findings. What's difficult and what is the role of the physician is to come up with the appropriate treatment plan for the appropriate patient. And that tends to be quite challenging at times.
I see a wide range of orthopedic conditions ranging from arthritic problems to sports injuries to overuse injuries. Most of the problems that I see are centered around the knee and shoulder. However, I do see a fair amount of neck and low back pain as well.
Richmond Bone and Joint Clinic is a complete orthopedic care and resource center staffed by a team of caring orthopedic surgeons spanning decades of experience in hand and upper extremity, spine, and sports medicine. For more information, contact Richmond Bone and Joint Clinic today or visit rbjc.com.